Hello, my name is Mary Kazirange. I'm the MCA lead for the West Yorkshire ICB in Leeds. I work with the safeguarding team. I just thought I'd bring you an update on the liberty protection safeguards position and the way forward. This is following an announcement which was made by the government in relation to the liberty protection safeguards. If you recall, some time back, I think 2 years ago, I did a presentation on what liberty protection safeguards would mean to primary care. So I thought it's necessary to come and give you an update on the position. We were all anticipating that, we would be implementing liberty protection safeguards sometime next year, if not late this year. But on the 5th of April, 2023, the Department of Health and Social Care made an announcement that, we were not going to implement liberty protection safeguards this side of Parliament, basically meaning, this government, current government is not going to implement liberty protection safeguards. So I thought it's necessary to come and talk to you about what this means. So practically, it means that, we will not be able to talk about liberty protection safeguards until 2026 or 2027. That is, however, dependent on what the new government would like to pursue. The current government says they are still interested in pursuing liberty protection safeguards, but they do not have the resources or the ability to do it during this period. So most likely late 2026 or 2027, if they will implement it. Whilst this is disappointing to some stakeholders who have been working hard to implement LPS, we should remember that all is not lost. So the next few months will inform us of any further feedback from the consultation that we did around the Mental Capacity Act, Amendment Act 2019, and the consultation. So we engaged with primary care on feedback on your views of what you thought about the draft Mental Capacity Act Code of Practice, which was now combining liberty protection safeguards and the Mental Capacity Act, because at present we have two separate codes, one for deprivations of liberty safeguards and one for the Mental Capacity Act. But the proposed draft code of practice was combining these two, and we had done well in Leeds. We had engaged with stakeholders, given a lot of feedback, as well as many other people across the nation. So they owe us at least an outcome of that, of how they process the information and their views on all that. They promised to publish that, but they haven't given us a date as to when they will be publishing that. Practitioners have been asking if we will at least have a new code of practice for the Mental Capacity Act, because the current code of practice is way out of date, and often when we are creating guidance, we have to patch it up with case law and common law. So we're hoping that, at least the government would update it with relevant case law that is developed. But again, we still do not know. Maybe in the next few months we have some further announcements, and if I get anything, I'll be updating you via the primary care bulletin, via extranet. So most of the work that we've been doing in preparation for liberty of protection safeguards remains relevant in terms of embedding the Mental Capacity Act. So at least we can be comforted in that, the work that we've been doing has not been in vain, because it is work that is still relevant to what we do at present. So the plan now is to focus on systems and processes that will enable us to better understand and to use the Mental Capacity Act in practice, and to improve due legal process that we use when someone is deprived of their liberty, to make sure that, we are upholding the human rights of the vulnerable citizens in our city, and that we can only do when we fully understand, the law around it. So in terms of embedding the Mental Capacity Act, there is need for us to focus on what is happening in practice. So for primary care, I suggest that, it is important that you review your everyday practice, you do some audits of your own, and people can identify knowledge gaps in practice around Mental Capacity Act, and you can always engage with us if you need training that is specific to your practice or to your PCN. I'm happy to come and support you with that. One key thing is to be very clear on consent and on how to use the Mental Capacity Act for those who lack capacity to consent to health interventions, including investigations. Often we meet individuals, unfortunately, who are no longer able to give valid consent for healthcare interventions and investigations. In those situations, we should not just do random decision making. Our decision making should be guided by the Mental Capacity Act in terms of assessing capacity and best interest decisions. So it is time to reflect in your areas, to think, to see, and to determine if you are confident in implementing the MCA in those kind of situations, and where there are gaps, get in touch and we can support you with some training. And also another pertinent issue is if an individual is continually refusing health interventions, or if significant others, family or friends, are interfering with health interventions or investigations that you want to do on behalf of the individual, you should consider making a safeguarding referral or seeking advice at the least, and we'll be there again to support you as needed. So in terms of deprivations of liberty, it is important that, primary care practitioners are clear on what is a deprivation of liberty. We've done a lot of work during our implementation work for liberty protection safeguards around the definition of a DOR or of a deprivation of liberty. But I understand, it's something that you don't use every day. So if you need an update at any time or at any point, just feel free to request and we can come and deliver, pertinent training or relevant training for your practitioners. I've put in these slides, some links to some documents which will give you easy and accessible summaries to enable you or to refresh your knowledge around what is a deprivation of liberty, and to enable you to identify it. Once you identify, primary care are not obliged to investigate or to assess or to complete, the paperwork that is required to legally authorize a deprivation of liberty. Your responsibility is to flag this up with the relevant people. If it's care homes, with the care home managers. If it's in the community, flag it up with us from the safeguarding team, or with the DOS team as well. You can flag anything up with them. Once you've identified it, then someone will be sent out to complete the relevant assessments. That way we avoid a situation where someone is deprived of their liberty illegally. It is not only costly in terms of we can incur, some financial implications if we do not uphold people's human rights, but more importantly, we'll be undermining the autonomy and the self-determination of the individual. These are vulnerable individuals who are relying upon us to use the law that is there to safeguard their right to liberty, and we should do all that we can to make sure that they realize that protection or these safeguards. So as GPs, what you might be asked to do is when someone is deprived of their liberty in the community, there is a process that is required in order for the authorization to be legal. The process involves using the court of protection. So your portion is to provide the diagnostic or the diagnosis of a mental disorder, or a letter confirming that there is something that is impacting on decision making or impacting on how the individual makes decisions. So there is a template of a letter which we've created together with LMC, and if you complete the letter, you will be given £50 as well for that letter. So you're not doing a big thing. The letter is quite easy to fill. We try to make the letter as less complex as possible because we know you're busy. So you only need to fill in some bits and bobs, and the letter will be completed. Once completed, you just email it to the identified email address, and the rest of the assessments are completed by specialists like best interest assessors or case managers. So your cooperation in the authorization process is very much needed for community doors. For all the other doors in care homes and hospitals, your main issue really is to just identify and to flag it up with the relevant people. So I hope this refresher and this update has been of some use to yourselves. Thank you.